So next up, we'll talk about the acute management of A-Fib with rapid ventricular response, or RVR, and that's defined as a heart rate of greater than 110 with the irregular rhythm. So first, if it's a stable, hemodynamically stable, that's defined as a systolic blood pressure of greater than 90. It's always important to address the underlying etiology of RVR, whether the patient came in septic, underlying infection, hypovolemic, or even hypervolemic, for example, heart failure exacerbation, and address that underlying cause first. A lot of the times, instead of giving beta blockers, giving IV fluids to someone who's volume down can address this underlying cause. Then rate control, intravenous if heart rate's greater than 130, followed with PA agent once rate is controlled. Beta blockers are first line for this. Metoprolol is preferred in most cases. Again, this is for stable AFib with RVR. You can give an IV bolus 2.5 to 5 milligram of Lopressor over 2 minutes and repeat as required every 5 minutes for a max of 15 milligram total. So if you're giving 5 milligram dosages, those would be 3 in a period of 15 minutes. And then after that, you can give PO up to 400 milligram total daily dose. A lot of the times it's good to bridge from IV to PO to have that kind of prolonged cover for the heart rate. Caution of course, if patient has severe bronchospasm coming with COPD exacerbation or asthma exacerbation. You can also use calcium channel blockers, diltiazem. IV bolus can be given 0.25 milligram per kilogram, and that's an average adult, 80 kilogram, that's 10 to 25 milligram over 2 minutes, and you can repeat as needed every 10 to 15 minutes. Okay, and of course you would have to avoid this in patients with heart failure with reduced ejection fraction, and possibly reduce the dose if there is renal impairment as well, kind of dose adjust. So in the next series, we'll be talking about peristable, kind of in the middle, this systolic blood pressure from 80 to 90, and unstable AFib with RVR, it's a systolic of less than 80.